According to the World Health Organization, the practices are based on the theories, beliefs, and indigenous experiences to different cultures. These traditional healers play a positive role in providing accessible and affordable healthcare to many. These medicines are used for treating and managing some diseases, all from nature, such as plants, tree roots, and leaves. Kimberley-based herbalist Rieden Beekers have been providing medicines for different purposes.
Gamagu is used for back pains, is for arthritis and for rheumatic. When people have joint pains, inflammation, ulcers, when you have high blood pressure or sugar diabetes, this herb is used to boost your immune system. When you have pains that you cannot address with anything else, you can only use this as a natural alternative.
Beekers learned over the years to use the traditional medicine for any illness. These medicines can be boiled to be taken orally or can be taken uncooked and used as ointments too. Beekers maintains nature is the greatest resource.
Many diseases and illnesses, we must just go back to the ancient way in order for us to live in this time, you see. Because many people, they do not know of the herbs, just go back to nature for all that they need, you see. So this is our greatest resource in South Africa, is our nature, you see, it's our creation and our biodiversity.
This herb is called Ipakama. Ipakama is used for attracting luck.
Another Kimberley-based traditional healer for the past 19 years uses tree barks too as herbs, one being Inukani.
We normally use for women, which is for your abdominal, if I should put it that way, abdominal or feminine ailments. I would speak about one of them, which is Unukani. Unukani, we also mix it with other herbs where you can use to steam, which nowadays they call it your yoni steaming, they call it that way. It's one of the practices that has been, it's one of the indigenous practices that has been used for quite some time.
Just as Western medicine, there is a dosage given to those that use it.
Oral medication, which we call imbiza. Ne? We call it imbiza. There's definitely a dosage. And one requirement would be you have to finish the course. You must finish the course when you've started whatever imbiza that you are taking. And dosages are informed by a whole lot of different reasons. That could be your age, your weight, also, determines some of the dosages and your height.
According to the Department of Health, about 80% of Africa's population relies on traditional medicine for their basic health needs. To add on that, during the COVID-19 pandemic, many people used traditional remedies for the prevention and treatment.
I'm one of those who believe in the traditional medication. Our traditional healers are doing a marvelous and wonderful work. So people, I don't ever doubt.
The National Department of Health says traditional medicine, as a major provider of healthcare services, cannot be underestimated.
These regulations will contribute towards industrialization of traditional medicine products and they are an integral part of value chain. The Department of Health is mandated to implement legislation pertaining to the work of traditional medicine and traditional healthcare practitioners.
It's believed traditional medicine can educate many and ensure a safely environment that's free from harm and contribute to the sustainability of harvesting medicinal plants. Karabo Sioko, SABC News, Kimberley.